we all know diet plays a very important part in management of diabetes. One question that usually asked is whether diabetes can be managed with diet alone. A large number of people can do it. They are doing it very well. So along with that, maybe we need some lifestyle exercise also. We'll be focusing on diet on whether you can use sugars a little bit in diabetes. I will say only as a treat. Better to not use it at all. Better to not use it at all. If you are having a very well controlled diabetes, you're checking blood sugars very frequently. And if you're going to attend a party or if you have a family function where some sweet dishes are being prepared, okay, you can take it very less, very little bit of just to taste it. You can use it. That's okay, fine. But you should be aware of your blood sugars and should be under very controlled. What about sugar alternatives? Preferably, no natural sugar alternatives be used because it's almost same. Whether honey or jaggery, everything is same. So no, don't use any alternatives, sugar alternatives which are natural. But artificial sweeteners, which includes a lot of artificial sweetener brands are there. Basically, the chemicals are either aspartame or sucralose, or there is also something called stevia. This can be used. It can be. It produces no problems. It can be used when people are making sweet dishes using this sugar artificial sweetness that you can use. But as such, sugars about as much as possible, and it should be used only as a treat for your very well controlled diabetes. Then you can have a treat when you have an occasion.